Welcome to the Optimized podcast from Prescribe Fit, where we explore the intersection of orthopedics, lifestyle health, and virtual care strategies to optimize patient outcomes and private practice success. Join us to hear from industry experts as we dive into the tools, technologies, and approaches shaping the future of orthopedic care.
Hi, listeners. Welcome to the Optimized podcast. I'm your host, Brock Leonti. Podcast is for clinicians, physicians, industry, and orthopedic and healthcare professionals. I'm joined today by Dr. Howard Lux, a board-certified orthopedic surgeon and author of the book Longevity Simplified. Living a longer, healthier life shouldn't be complicated. Today, we'll explore trends in conservative and treatment approaches, rehabilitation strategies, and the latest innovations shaping the future of orthopedic medicine. Hi, Dr. Lux. Welcome to the podcast. How you doing?
Hi, Brock. I'm doing great today. Thanks.
Excellent. Excellent. If you wouldn't mind starting off with a short bio of yourself, that would be great. Let us get to know you a little bit, who you
Yeah,
are,
sure.
what you are. Yeah.
So I'm born and raised in New York, still in New York, although I did leave for a while for college. Trained as an orthopedic surgeon. I finished up my training down in Manhattan. I became the chief of sports medicine at Large University Center here, trauma surgeon at night. I left there about 4 years ago. Now I just have a nice, quiet sports medicine practice. My practice methodologies and my approach to my practice has changed a lot since I started. It started to become clear that a lot of orthopedic and MSK issues didn't need us to intervene, and that people would do fine if we waited longer, supported them a little better. And later it became really clear that optimizing people's health was super important, not in that it helped them necessarily avoid surgeries, but it became very clear that those who were properly optimized did better after the surgery. They recovered faster, had fewer complications, etc. So that and my interest in longevity enabled me to write the book and come to my practice with a much more patient-centric or holistic approach.
Your work has spanned from surgery and orthopedics, sports medicine now, longevity science, authoring a book. You have a podcast yourself. So when you look at your career, is there a trigger point or what initially led you to focus on patient optimization and the long-term aspects of musculoskeletal health, the science behind that? Is there a story that you have?
Yeah, it quickly became clear very early in my practice that not every MSK issue that shows up on an X-ray and MRI needed my intervention. People would cancel surgeries for various reasons, and you see them back in a few weeks. They're like, "Hey, I'm feeling better. Do you think I need the surgery?" I'm like, "No, you don't." So that was part of my education. Then it became clear that people who were healthier were coming through these surgeries a lot better. If you take a somewhat frail 70 or 80-year-old to the operating room for a total knee or total hip, they didn't recover nearly as fast as those in the same demographic and age group, but who were far healthier. We saw wound complications, poor healing, poor muscle mass and strength development, and their recovery just seemed to drag on a lot longer. Then I started to look into it. I started to research it. Then came recovery from surgery, the nutrition guide. I started to see the importance of prehab in the literature, and it all just started to make sense. I've never done the original literature, but I'm very good at absorbing it and putting it to work in my own practice.
Yeah, and making it simplified, truly the name of your book for others to understand. I mean, that's been the comments out there. And as I've read it myself too, I mean, it breaks it down into simple terms, simple concepts that someone can just consume and execute on, right? So when you look at your career in orthopedic health and what lifestyle has done to that, how has it evolved? How has your perspective evolved from when you first started your career? Is there stories or things that you could take us through that made you really realize this is something that needs to be brought as a higher priority in someone's care and it's meaning?
Sure. I mean, it became very clear very early on that just look at the average patient who's undergoing a total joint procedure.
Mhm.
Usually they're not nearly as healthy or active as people who are not in the operating room for the same procedure, meaning that it's obvious that sure, genetics plays a role, but so does our overall health, including what we feed ourselves and how much that we move.
Mhm.
And it, yeah, it also became very clear that those who were active before surgery and didn't wait until they were too run down, they always did better and recovered faster than those who waited a little too long or didn't receive any prehab, didn't receive any nutritional counseling prior to surgery. So, and this has only become more clear the further along that I go. My goal is not only, it's not to do 10 cases a week, it's to make sure that the cases that I do, the people can recover from, and I've optimized them to, to a point where I'm going to minimize their pain and suffering from a complication, my pain and suffering from the complication, and my hospital's pain and suffering from a complication.
Mm.
So it's become more and more clear over the years just how important these lifestyle interventions are pre and post surgery.
Mhm. That's excellent. That's excellent. And I'm sure as you see that day in and day out, I mean, you really get to know that this works. I mean, this is something that works. So we have at this point, I want to take just a moment. We have a unique and personal question today. So each time I'll be asking a unique question that exercise is an opinion from you, but is also rooted in fact. So today's question is if you could only do one type of exercise, and I know that you're big into exercise, seeing you on LinkedIn and doing those things yourself. Like, do you have videos of you pushing sleds and doing all of that? So if you could do one exercise for the rest of your life, what would it be?
I'd say tennis.
Tennis.
So
Fascinating.
the data on this is actually there to support it
Okay.
because,
Okay.
and this is important, not only do we need to just move, right? We need to move more occasionally with ferocious intent, but a huge up and coming problem these days is loneliness and social isolation. It's a
Right.
huge problem, right? So I can spend every morning running alone on trails or occasionally with a group of friends. But if you get out on a tennis court, you're there with three other buddies, you're going to meet up and eat beforehand. You might hang out and eat afterwards. So you're running around and you're getting that socialization that's really, really important. As you age, when you're young and your kids are all over you and you see them at games every week, you don't think about this. But when those games are over and your kids have flown the coop, it becomes a very apparent just how big of an issue this is.
And the social, your social aspect, like you said, that the mental acuity is there. You exercise a little competitiveness as well. So you
Yep.
get it all. Mine was definitely not as well thought out, or mine was deadlifts. If I were to pick an exercise, I was thinking physically, man, you work out everything from your glutes, hamstrings, lower back, all of that,
Yep.
quad, but that's great. So I would socialize with, I guess, the weights that are there, but yours makes a lot of sense there. And so one of the fact that's widely accepted is walking and swimming are two that are some of the one that you did that kind of keeps your body going. And we've heard, of course, swimming is great impact and all that, but awesome. So looking at patient education outreach, it's a key component of patient optimization, right? Is understanding what you need to do as a consumer, as a person that's supposed to execute on this. So beyond your book, you've built a strong online presence. You've educated patients about like orthopedic health, lifestyle health. What role do you think education and digital content plays in shaping the future of patient care?
It's enormous. I mean, that's where people go for information these days. Sadly, the medical profession is getting beaten up in social circles as with pharma and big food. A lot of people don't necessarily trust us as much as they used to. But if you can put out content, especially some video content where it's personable, it's just you looking at a camera and talking. It's not overly scripted. It's really important. Another reason is patients will forget 80% of what you tell them in the office. So you can explain the whole process of a knee replacement to someone once, but they're not going to remember it. They're not going to do what they're supposed to do prior to surgery or after. And so the more that you put out there for them to consume and to revisit, the less problems are that you're going to have in the office. I see conversations on LinkedIn a lot about doctors complaining about all the phone calls that their office gets from patients after surgery. I have to say, I don't get them because to a large degree, it depends on how well the materials that you give them or your content is at feeding their need for information. Should they have questions? Should I feel this? Can I do this? Should I do this? Can I do that? Because these come about in almost every patient. So the more information that we have out there, the better structured it is, the less issues that we're going to have in terms of patients not understanding what we're trying to communicate and getting past the fact that they're just going to forget the majority of it when they're nervous and upset in our offices.
Yeah. I mean, they're being told, you're going to have surgery. That's big in and of itself, but then you're going to have to recover and do PT, come 3 days a week. You have all of these different things to be concerned about. So, really, there's a lot that is being there, but it's emotional for them at the same time. So the more fact-based things, the things that you want them to know that they need to know to be able to recover better and faster or even prepare for that, something that is sort of missing. So as you look at that, it sounds like video, it sounds like content, those kind of strategies are there to keep patients well informed. And that's something that was missing. Is there anything else that you can think of that would help private practices really communicate with their patients better?
Yeah, sure. I mean, they can offload that responsibility to a number of companies. For example, your own. It fits the perfect need in terms of how to educate people about how to manage their lifestyle choices pre and post surgery, or sometimes instead of surgery. So offices have gotten busy and due to lower reimbursements, et cetera. So we don't necessarily have the time to spend with each and every patient to be sure that they understand all these aspects of recovery that are so important. So utilizing a lot of these other technologies that are now available to us is really important because it helps to share the burden. Companies like yours have spent years perfecting their business models and outreach and customer service. Yeah, we haven't. So I really enjoy using other platforms and technologies to accomplish this.
Yeah. And your website is definitely a notable hub for patient education information, which is great. So as you look at proactive preventive care, right? So we talked a lot about eating better, moving more in general, but to get more specific, you had mentioned your one exercise and mine there too and all that. But what are some of the most overlooked but impactful lifestyle changes that can prevent orthopedic injuries, chronic conditions, or metabolic health? All those.
Yeah. I could write another book on this topic. The people get the risk equation all wrong. They look at exercise as a risk. They don't look at the risks of being sedentary. My saying that is in large print on the wall in my office is exercise is the risk you take to avoid the complications of being still. And it couldn't be more true. More people are hurt by not moving than those who are hurt by moving. The actual injury rates of weight training, running, cycling, etc., are very predictable and very low compared to the downstream consequences of not doing them.
So just to pause there for a second, because that's what's so great about your book and your take on things is you make things so simplified, but that just seems like the concept that doesn't resonate with some people. They would think if I'm injured or if I I'm sedentary, I'm much less likely to get injured. But what you're saying is the rate of injury is higher if they're not moving than those that actually move and exercise. And all.
Look, from an evolutionary perspective, the human body was engineered to move. All our metabolic systems work because of movement. They're more efficient and effective because of movement. Dr. Inigo San Milan put out a paper last year, and it contrasted the metabolic functions in a cell in sedentary people and people who meet the WHO criteria for moderate physical activity. Now, mind you, everyone gets moderate physical activity wrong. From a research perspective, that's fast walking, right? So I'm not talking about you got to go ride 20 miles an hour or run a 9-minute mile, but the differences were striking. There were 30 to 40% decrease functioning in the proteins, in the efficiency and effectiveness of mitochondrial function in the sedentary people. So if you're looking at studies on metabolic health and physical activity and its effect on the human body, that tells you that sedentary shouldn't be the control group. The people who move should be the control group. The people who are sedentary, being sedentary has become the intervention. Humans weren't meant to be sedentary. We weren't meant to exercise.
Yeah.
Right? We were meant to move. We were engineered to move. Our bodily processes and systems were engineered such that physical activity promotes them to work better. So it is absolutely critical that we remain physically fit. You asked me the one sport that I would do if I had to choose, right? It's like asking me the one food that I would have to live on.
That was
Okay,
our question
pizza.
last time. What is it?
I'd say pizza.
Pizza.
But that's not what I do, right? I weight train 2 or 3 days a week. I run 3 days a week. I cycle. I rock climb. I'm constantly trying to push myself in different directions because strength training isn't enough. We lose a lot of power and balance. And if you look at what's a significant driver of human disease and death, is falling, right? So our falling risk goes up dramatically as we age. And the fall isn't the cause of death, but it's an initiating event, right? Frailty doesn't come to a human in one fell swoop. You don't wake up one day and you're frail. But in your 50s or 60s, if you're not exercising, you've already lost a substantial amount of muscle mass, right? You lose a lot as we age. So if you don't weight train, let's say you break your ankle, you're in a cast for 6 weeks, you've lost about 10, 12% of your muscle mass. Cast comes off, you do a few weeks of PT that's only focused on the ankle. So now your baseline level of fitness is now lower. A year or two later, you get the flu. You're in bed for a week, you lose 8% of muscle mass by spending a week in bed.
Wow.
So then you get up and you get around, but you don't exercise. So you return to your normal activities. Your baseline level of fitness and health is lower. And that just keeps happening until a large event where now you can't recover from it. So it wasn't that last event that did it, but it was all the injuries and illnesses along the way that just kept notching out a certain amount of our fitness level.
And they say now sitting is the new smoking. I mean, really, and that, if that's a phrase that you accept there. But so when you look at this, how do you guide patients? Maybe they're in pain, or maybe they have limited mobility, or how do you guide them to stay active while they're in that state?
Yeah, you can find a way with each patient. I don't push them into gyms. I ask people in my office to do 2 30-minute walks a day. Okay. Start with 1, get up to 2. And then I want them to do things like chair squats, calf raises, a push up on the kitchen countertop,
Okay.
just very basic movements, because most people are not the least bit interested in doing this,
Hmm.
right?
Right.
But many can be convinced that it's super important. And if they're staring down a procedure or surgery, once they understand that this will smooth their recovery,
Hmm.
they do tend to engage.
Avoiding unnecessary surgeries too. So if maybe they don't need it, or maybe you could circumvent that, avoid the surgery or delay it. What are some of the most effective conservative treatments that patients should try first? How would you guide them towards that?
Walking is the most important.
Okay. Taking a walk.
By far. Get out of the house, grab your dog, grab a friend, go
Hmm.
walk. It doesn't matter what the pace is, but walking is actually one of the best activities for a painful joint. The general literature on strength training
Hmm.
and pain relief is pretty mixed, actually. In general, people who are stronger and fitter don't deteriorate as much. It's true with our metabolic function. It's true with our joint function as well. Sure, if you got a bad roll of the dice because of genetics, not much is going to change. But as I mentioned earlier, our joints are hurt more by inactivity than they are by physical activity. Our cartilage has no blood supply, so it derives its nutrition from joint fluid. That joint fluid needs to be forced into the cartilage under pressure. The joint fluid itself is really important because people with various metabolic diseases, type 2 diabetes, etc., have a lot of inflammatory mediators and cytokines running around in their plasma. Well, they make their way into our joints,
Hmm.
and that will have an effect on the health of the cartilage. It
Hmm.
has effect on the macrophages. So a lot of macrophages in healthy people's joints are, they're in a healthy state and they are there for repair, but they can be changed into very obnoxious state where they start to incite inflammation
Hmm.
and degradation. So our metabolic health and lifestyle choices affect our risks in many different ways.
Sure. Sure. Yeah. I mean, that's from the personal side. About 3 years ago, I had a herniated disc, both both sides of L5S1. I mean, we're going up and down. One was hitting my sciatic nerve that went down. I was in a lot of pain, and I remember it was so chronic and painful. I was signed up for surgery, and I turned to a friend that's an orthopedic surgeon and said, "Hey, what do you think here? Can I get a second opinion?" And we sent the disc down and to someone MRI disc to another surgeon that was neutral. You should just go get 2 injections and go under some really strict
Yeah.
PT, but make it strength training. Go through strength
Yeah.
training. And I did, and I found someone that was a personal trainer, physical therapist combination, and I have never felt stronger today. I'm able to do the deadlifts, the exercise that I
Yeah.
said that I'd do, or that kind of thing. So, I mean, there was a surgery I kind of avoided it. I feel like it was unnecessary, but sometimes you don't know the things you don't know, and unless you're listening to someone like you who's insightful or have a service that's there, or you see an orthopedic surgeon, you won't get that perspective. So when you have patients that do require surgery, what are the most important steps that they can take to optimize prior to surgery, post surgically on recovery side? What can they do?
The three things is prehab.
Mhm.
So they do need to strength train, hopefully try to improve their mobility of their joint a little more, protein intake
Mhm.
and creatine, which help aid in reversing the catabolic state that
All right.
occurs after surgery. So those are really three important interventions.
Hmm. So taking those supplements definitely helps as well. I mean, when you look at that, and is that something that you feel they should get through their nutritional profile or that they intake, or do you recommend that they seek out that support from a provider to be able to know and understand exactly what they should take?
So, no, I mean, the issue is you have to eliminate the friction, right? The more friction there is in the system, the fewer people who will engage. So, a booklet that I give to people, it's about a 50-page booklet, has a number of exercises in there for the preoperative sessions. So people will do them. Most will do them. The few who have difficulty, I will give them a prescription for formal physical therapy. In terms of hitting nutritional needs, it's very hard for people to get 1.6 grams of protein per kilogram per day. So we can use Ensure, or if they are willing to, they'll buy a protein powder and they'll mix a smoothie or a shake. They can put the creatine in anything, a bowl of cereal, a glass of juice. It doesn't matter. It has no taste. So again, I try to eliminate the friction from the process as much as possible.
Sure. Yeah. Even those small little pieces of advice make it simple for someone to understand and
Right.
to execute on, right? I mean, that's
Right.
great. So our optimized podcast, we have a signature question that we ask every guest. This is the same for every guest here. But if you could give every patient one superpower or piece of advice to optimize what would it be and why?
Yeah. To maintain your level of functional fitness and to maintain it throughout your life, because it has such a tremendous impact on your existence. And human frailty is an awful place. When you visit your parents, and luckily mine are still alive, and you see them and their friends walking around and they're all afraid of falling
Mhm.
or stumbling. And can you imagine having to navigate your home when you're afraid of falling? And now being 60 and easily remembering when I was 20, these decades go really fast.
Mhm.
And you're going to wake up one day and you're going to have a belly and you're going to have a hard time going upstairs. You're going to be winded. You're not going to be able to carry that 50-pound bag of mulch around to your backyard. And you're just going to think that that's an age appropriate change and that's just old. That's not true. We have the ability to maintain our physical capacity. Most of us do. And if we're experiencing some joint pain, some arthritic change, that should be an indication to double down on your physical activity. You're not going to protect your joints by remaining still. Quite the opposite. The more sedentary you are, the worse your arthritis is going to get. And the more symptomatic it's going to be because of inflammation.
Mhm.
So physical activity and maintaining your physical stature is of utmost critical importance throughout your life.
That's a great message there because I think that just conflicts with the way people think naturally, right? If I hurt, I should stop. And
Exactly.
yeah, and
Exactly.
now if you hurt, you should keep going and go twice as much. And those are
Much like you, I've had back pain since I was 18.
okay.
It
Yeah.
started when I wanted to be a professional tennis player. And I had one or two episodes a year
Mhm.
for a long time. And back then it was a week of bed rest, which was ridiculous. But what I have found out is being as active as I am in the gym, one, I have fewer episodes. Two, I still go even if I tweak my back. And each time it never hurts more when I'm working out.
Right.
And it shortens the duration of these episodes. And I'm having fewer of them. So unless there are red flags, unless there's a fracture or a tear or something that you're going to make worse, there's no reason to stop. And
Mhm.
most of the things that you think you're going to make worse, you're not.
Mhm.
So it's, yeah, it's easy to come up with an excuse to stop moving. It's harder sometimes to find that drive and to quell those voices in your head that are telling you to stop moving.
Mhm. Mhm. And for people The great thing is you and I have been fortunate to exercise and to kind of know what to do for those exercises. Cause I'm the same way. If I stop and I feel my back, hurting, I go exercise. That's the first thing that I can think of. And it does,
Exactly.
it shortens the course. It stops it from hurting as much and it eliminates it. But for those that haven't exercised really, I mean, it can be a daunting thing. I'm helping a friend right now who hasn't exercised in quite a few years. And when we're in the gym and exercising, it's painful. It can be painful. So I'm like,
Right.
it's different than chronic pain that was really there.
Right.
But I think it's helpful to have some sort of support there too. Reading your book, finding educational things, asking your doctor, talking to friends that know what they're doing or family or someone significant in your life can really help bring about more confidence to be able to take those first steps as well.
Agreed.
Yeah. Anything else you'd like to discuss today? Any other topics that you feel like I should have asked or we should have touched on? All right. That's great. So just so we can tell our listeners, where can they find you? Where do you have LinkedIn, website? What's the best place
Yeah.
to find Dr. Howard Lux?
Twitter and LinkedIn is where I'm most active.
Okay.
And my website, which is my name.
Great. Yeah.
Not hard to find.
All right. And we'll be waiting for that next book that you mentioned on creating on the movement here. So that's great. So thank you for joining us today. That's a wrap of today's episode of Optimize, where we empower providers to enhance patient care. Appreciate you joining us as we explore the innovative ways to improve patient outcomes through lifestyle health. If you found today's discussion valuable, please be sure to subscribe, share this with your colleagues, leave a review. It helps to continue delivering content that supports you and your practice. Thank you very much. And thank you, Dr. Lux, for joining us today.
Thank you.
Thank you for listening to this optimized podcast episode from Prescribe Fit. Make sure you never miss an episode by following the Optimized podcast in Apple Podcasts, Spotify, or wherever you listen. If there are any topics or guests you'd like to hear on our show, email your suggestions to optimized@prescribefit.com. And to learn more about Prescribe Fit's virtual lifestyle coaching and remote patient monitoring program, visit prescribefit.com.